I will say I work at Barry Memorial, and I'm the administrator of the Physician Corporation.
Right.
And that is one of the things that we do struggle with. The size of their practices is such that it's not that they're not taking new Medicare patients, that their practices are so established. Many of our physicians have been in practice 15, 20 years. They don't, being a part of a not-for-profit organization, we can't opt out of Medicare, obviously. Right. So the Physician Corporation, and many of them are employed, we don't allow them to opt out. They're full in the form of they have no more capacity. They work until 6, 7, 8 o'clock at night seeing patients, or subspecialists. But the big problem I have, or the concern I have, is once we have this large contingent of people who now have health insurance accessing the system, and primary care is not, people don't want to go into primary care anymore, and that's the gatekeeper. I mean, we struggled. I mean, I hear from a lot of people, I can't get to see a primary care physician. They're not, it's not what most people go into anymore. Sure. They want to go into the subspecialties. They want to go into surgery. So my big concern is there's not enough of them.
You're right, and we're driving them out every day between the reimbursement rates and the lack of tort reform that continues to drive up their malpractice insurance. It's a problem for family practice physicians, and you're right. There's a critical shortage of those, and that's going to continue to be a problem. Don't forget that also a part of the President's health care law is expanding the population that qualify for Medicaid, and so that's going to put that's going to put an increasing strain on the system as well.
But those people do deserve health care.
Oh, there's no question. All Americans deserve health care, affordable, accessible health care.
So, is there a way to create more primary care physicians by offering the best and the brightest free education?
Well, who's going to pay for that?
Well, it's less expensive to pay for that than to pay for Medicaid or Medicare.
Well, the plan that we have launched in the House of Representatives, and that now sits languishing in the Senate. The Senate will not even dialogue with us on a plan to save Medicare, to strengthen and preserve the program. But just some of the tenets of that plan that I have supported is number one, put competition back into the system. Just like in any business industry, when you put competition, when health insurance companies have to compete for your business, that drives costs down, that drives quality up, and everybody gets the benefit. How do we do that? Make health care portable from state to state and job to job. Don't just be a captive audience. Another tenet of our plan is robust health savings accounts. Let Americans invest with pre-tax dollars into health savings accounts so that they can pay some of their routine health care at a much lower cost out of pocket than it would cost them to get one of these large health care policies. And then I mentioned earlier tort reform. Eliminate the frivolous lawsuits. I don't know if you've heard about what's happened in Texas. In Texas they implemented tort reform, and today I've heard stories about how difficult it is to set up and get a license to practice in Texas, and it's not because the process is unwieldy or overburdensome. It's that the line is so long. They've implemented tort reform in Texas, and you've got lots of physicians that are moving their practice to Texas where they can pay lower malpractice insurance and those kinds of things. There are a couple of things in the President's health care law that I think merit consideration to keep. One of those is the pre-existing condition exclusion. I don't think people ought to be denied health care based on pre-existing conditions. Many people don't have, they didn't put themselves in that situation. Some people are born with situations where they have those kinds of challenges. And then I think it's also a good thing that parents can keep their children on their health insurance policy until they're 26, given today's economy. I actually had a lady tell me once, she said, "I don't like that." She said, because that gives young people no incentive to go out and find a job and begin to take care of themselves. And I said, "But ma'am, it's a family choice. It's not a mandate. It is a family choice. If you, based on how you're raising your kids, if you think that that's a detriment to them, then you'll have the choice to do that or not to do it." But given the fact that about 50% of America's college graduates are either unemployed or underemployed today, you know, we got young people that are graduating from college and then they can't find a job. So staying at home with mom and dad until they can get on their feet is an important thing. So those are some of the things that we're trying to do to keep the quality of health care up, to keep decisions between patients and their doctors, because our plan will also eliminate that IPAB board in Washington, D.C.
Would you speak to the individual mandate component of the Affordable Care Act and how you feel about that? And I want to know if the tax increase you referred to earlier, that is synonymous with the penalty on the free riders in the system who have paid can't afford to pay insurance but have chosen not to. But yet when they have an illness or an injury, they expect to be treated. So could you address those?
Sure. As far as the individual mandate goes, you know, I was pretty shocked, as I think many Americans were, that the Supreme Court ruled that the health care law would stand. I just did not think that they would say that, because I thought by my interpretation, my understanding of the Commerce Clause of the Constitution, that the individual mandate would be found unconstitutional. And in fact it was. Had the ruling been made solely on the individual mandate and the application of the Commerce Clause, it would have been struck down. What upheld the law was the fact that Congress has the ability and the requirement to levy taxes. And so they saw the penalty as a tax. You know, my mama used to say, if it walks like a duck, quacks like a duck, and looks like a duck, then it's probably a duck. And that's kind of what the Supreme Court has said.
Well, I think it though is misleading when you say that it increased taxes. A lot of people will assume that means I will pay an increased tax, this person. That isn't the case. It's the people who have chosen in the past not to be insured, but yet to seek medical care when needed, and the rest of us have to pay for that. The individual mandate would require that person to pay a penalty if they chose not. That's the tax. It's not an across-the-board tax.
Well, there are across-the-board taxes, and I'll explain those to you. So let me tell you where those come from. The individual mandate penalty is a tax on an individual. It starts out in 2014. I want to say it's about, please don't quote me on these numbers because I don't have the figures right here in front of me, but it's a very modest, let me turn my cell phone off, I apologize. It's a very modest penalty the first year. The second year, it triples. The third year, by 2016, it doubles. Even beyond that, it goes up exponentially. And after 2016, it's tied to inflation. So take a family of 4. You know, again, you've got young people staying at home. So you got a mom and a dad and 2 young people that are 18 years of age or older. You got 4 adults. You're going to be paying over $2,700 roughly in that penalty or in that tax that's going to be collected by the IRS. So that's where that individual mandate comes in. But let's talk about the across-the-board taxes, and there are lots of them. For example, over $20 billion will be generated in increased taxes on the American people because the health care law limits the amount that a family can put into health savings accounts. It places an upper cap limit on it, and today many families put a lot more than that. So they're going to start paying income tax on those contributions that they would be making to their health savings accounts. Some $5 billion will be generated because you can't use a health savings account to buy over-the-counter prescriptions. You're going to pay taxes on those. Over $62 billion is going to be levied on the health care providers themselves, the health insurance carriers. So who do you think they're going to pass those increased costs on to? Those increased taxes are going to go straight to the American people. And you've got well over $100 billion that's going to be generated because those families that make over $250,000 a year are going to pay increased taxes and investment income.
And that's in the health care bill?
Yes, ma'am.